I had the opportunity many years ago to work in Saudi Arabia. While I was there, I traveled to many different countries in Northern Africa, all over the Middle East and Southeast Asia, and had the opportunity to visit hospitals. And walking into wards that are overfilled with people in beds, people on the floor, patients that didn't have enough medical supplies. There were lack of dressings, lack of wound care supplies, lack of linen, lack of equipment. I looked around at this big problem and I said to myself, someday I'm going to do something about this.
Partners for World Health was created for a multiple of reasons. One of the primary reasons was the ability to provide medical supplies to people who don't have medical supplies. A second important factor is to try and reduce the amount of excess medical equipment and supplies that are ending up in our landfills. It is a wonderful ability that we have to go into a hospital environment to take away what hospitals no longer can use. We take them here to our warehouse, we sort through them, we evaluate them, and we, with a nurse's eye, repack what we have so that what we're sending to our partners in the developing world is what they need. We are working really hard to identify the needs in our community for home health care support, this wonderful byproduct of having all of these wheelchairs and hospital beds and other items coming in, that somebody can walk in and say, I just had surgery and I've just been released and I can't afford a wheelchair. Can you help me? And we can say, yes, we can.
I had always been bothered by the medical waste, and when I heard about Partners for World Health and the fact that they were trying to take all this material, sort it, and then send it to areas where it could be used around the world, I thought that was a great thing.
One of the things that I like about volunteering here at Partners for World Health, it's the usefulness of what we do. The need is so great.
I knew that the ultimate end was to be in a container heading somewhere overseas to Africa or Southeast Asia or wherever the need was. Figuring out how to fill a container and all the logistics that go into filling a container isn't something you learn in nursing school. Our goal this year is to ship 12 containers, and each container holds between 15 to 18,000 pounds of medical supplies that have a second life.
We have found that through our science and our little bit of art, that we can put close to 600 boxes in that container, and then we get to the end and go, oh, we don't have any space left. I'd like to put in one more. Can we squeeze one more item in? Can we put one more box?
Everything in here was going to go to the dump, everything. That's what's so incredible, is that our healthcare system has so many challenges in it, and if we're going to throw it away, then we ought to reach out and figure out how to help all these billions of people in the world that have nothing. They don't have access to healthcare, and they don't have access to all of these incredible medical supplies that are sitting here in this big box, and we don't ship air. There's no air in here. We could hardly close the door, which is even, love it. Whenever we send a container, we try to follow up with a medical mission. We will be going for the first couple of weeks in January to Uganda. The one in March goes to Bangladesh, and then we go to Senegal in May. August, we're going to Malawi, and then there'll be another trip interspersed in there to Liberia and Ethiopia.
What we normally do is show up with a team of nurses and doctors and other health professionals who will work on the ground with the team that's already there, making sure that the knowledge that we are sharing with them is done in a way that they can then use it for future care.
This is very bad. We also have other projects, and one of them is called Project 10,000. And Project 10,000 is a project that we are going to educate 10,000 pregnant women in Africa about the complications of pregnancy. And then at the end, we're going to provide them with their own birthing kit that we make, that were bound for the dump, are now being reprocessed, repackaged, and made into this birthing kit. In addition, we will provide a community-wide education about breast cancer or how to do a self-breast exam. The point of this is to be able to reach out to hundreds of thousands of women about the fact that no one needs to die of breast cancer today.
Coming to a country like this is definitely worthwhile, not only providing equipment and supplies and those kinds of resources, but providing the education to use those resources. And I think even knowing that we will come back to reinforce what we've been teaching keeps them hopeful in overwhelming situations.
There's a lot we get from you. We get the equipment that is good for the babies. We get the teaching, which always makes us remember what we're supposed to do. And we get so excited.
Especially when we use their interventions and their equipment and we see babies surviving. It is a miracle. And we are really happy.
Every time I go on a medical mission, there's always something new. And it's always one of those moments of, oh my God, how could this possibly happen?
She doesn't have anybody.
He doesn't have a family?
He doesn't know where his family is.
It's really worth it to take the time and energy and come over here and help to make a difference in people's lives because they don't have enough support and they don't have enough supplies.
Oh, yeah.
Mothers have got support from this clinic, and I must thank the partners for World Health for providing this support.
It's helpful because it is educating a lot of the people in the country to be knowledgeable enough to care for themselves. It makes our work easy. I even told you that this is how I started smiling. I didn't know how to smile.
Just seeing these healthy, happy babies just makes my day, it makes the week, it makes the month. This is what we do and this is why we do it.
Okay. It's important for all of us to give back. If we all tried a little here in our world, if we all tried to make a little bit of a difference, we could have a huge impact on so many people's lives.